Barely a week after tens of maternal patients narrated their ordeal at the Moi Teaching and Referral Hospital Eldoret over unpaid bills, a viral clip showing new mothers allegedly detained at the Thika Level 5 hospital over unpaid maternity bills has emerged and reignited debate on Kenya's health financing. The growing number of mothers detained after birth intensifying scrutiny of the SHA benefits package, with health experts warning that systemic gaps are trapping vulnerable women in hospital wards. As you'll hear now from Mary Muoki, experts have called for a review of the SHA benefits package to reflect the true cost of services.
Kama wamama tunaumwa na tunahisi uchungu kwa sababu kuna wale tuko na watoto home. Watoto wetu kuna wale wana mababa, mtu analea watoto single mother.
These mothers say they have been stuck at Thika Level 5 for months, detained because they could not pay maternity bills, even though SHA was designed to cover deliveries. These scenes have drawn condemnation, with critics accusing the government of punishing women for giving birth.
So some of the problems we are having is that the politicians are going around and saying that go to hospital, it is free. But when you reach the hospital, if you have not paid the premiums for SHA, you will not be paid for by SHA.
But if you have been referred and you are not able to pay, then the government has a program to ensure that the indigents are paid for.
On paper, the government insists antenatal, postnatal and delivery services are free under the primary care network, but in reality, SHA contracts make proof of contribution mandatory. That leaves many mothers ineligible, especially in emergencies like cesarean sections. Section 25 of the SHIF Act directs Parliament to allocate funds for indigent and vulnerable persons and tasks national and county governments to pay for the cover. But those provisions remain unimplemented, leaving hospitals with no ring-fenced funds for the vulnerable mothers.
The costing has not been done. So the best tariffs would be the tariffs which are at cost. And therefore, we recommend that a costing be done. As it stands, 10,000 shillings for a normal delivery is not adequate.
If there is an area that needs improvement, we have our benefits and tariffs committee that sits, and every time they are able to improve on the tariffs that are not at par with the issue that needs to be.
Experts have urged the government to fix the systemic issues plaguing SHA, to restore the dignity of mothers and avoid issuing empty promises that don't match reality, adding that until SHA benefits are properly costed, Kenya's most vulnerable women will keep slipping through the cracks of a broken system. Mary Muoki, Citizen TV.